Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of ifixyoursciatica.com, a go-to resource for pain management. When it comes to pain management, there are a lot of different ways to treat these conditions. If you're listening to this podcast, you are suffering from chronic low back pain or specifically sciatica. And there is a lot of different pharmacological, a lot of medications that you can take that would actually help with reducing some of the pain. But the effectiveness can actually be blunted because we might not necessarily have a huge understanding of the medication's role in our recovery. And I met today's guest a few months ago because I was looking for someone who can truly explain the importance and the role of medications when it comes to pain management. And who better to talk about medications than a pharmacist? So on today's episode, I have my good friend, Dr. Matmon Harrell, who is a pharmacist based out of South Carolina. And a few months ago, we actually had the opportunity to get to know each other a little bit more. And after speaking with him, I said, I would love to get him on this podcast to tell the world about what he's an expert at and how pharmacological, again, medications can actually help with the healing and pain relief process. So, Matmon, thank you so much for hopping on today's episode. I really appreciate you taking the time out of your evening because I know that you're out on the East Coast and I'm out on the West Coast. So there's a 3-hour difference. So thank you so much for hopping on.
Yeah, absolutely. Ashley, I'm glad to be here. Thank you for having me.
Absolutely. And so, Matmon, could you tell the audience a little bit more about yourself, how you got to where you're at today, and we'll take it from there?
Yeah, certainly. So I, like many seniors in high school, I really had no idea what I wanted to major in once I graduated and, from becoming a senior. And I remember thinking about becoming a dentist. And I actually quickly changed my mind because I couldn't foresee myself, looking in the mouths of other people. God bless dentists, all of you out there. I appreciate you. But it just wasn't for me. So I changed my mind in that regard. I remember in high school or senior year of high school, I took I enrolled in ROTC as an elective, JROTC as an elective. And, that training I thought would make me excited to join the military. And I was actually cadet of the year that year, my senior year. I mean, we're talking above people who had been in JROTC for their whole 4 years of high school. I was only in JROTC for that senior year, and I made cadet of the year. But anyway, I thought that would prepare me to join the military and be excited about that. But ultimately, my mom had a decision in me not pursuing that route. And, she's a single mom. She's like, no way, nobody's going to come in here and take my baby. So anyway, so I didn't do military. And it was mom's experience, actually. At the time, she had worked as a pharmacy tech in a community setting. And she used to come home all the time and rave about how much she appreciated the pharmacists that she was working with and how, she was knowledgeable. The pharmacist at this time was knowledgeable about so many different things when it came to medications and drug interactions and whatnot. And so she said, I really do think you would do well in that field. And of course, there was this motivation related to income. Again, my mom was single parent. She, raising 5 kids, and so money to her was important. And so she wanted to make sure that her kids had a viable financial future as well. And so she encouraged me and said, "Hey, why don't you try and enroll?" And so I did. I applied to Florida A&M University in Tallahassee, Florida. I was accepted, and really the rest is history. My experience, though, at pharmacy school or in pharmacy school, then at that time there wasn't really much prep work in terms of a specialty. Pharmacy school, for all intents and purposes, is really a catch-all. We focus a lot on the chemistry of drugs. I remember taking organic chemistry 1 and 2, and let me tell you, organic chemistry 1, man, kicked my butt. I got a C in or organic chemistry 1, and then I did better in organic chemistry 2, thankfully. But then I went on to the professional aspect of my educational career, and really started focusing more on, again, the pharmacology of drugs, as the quote specialty. They don't really teach you in pharmacy school specifically how to manage pain, for example. There's so many disease states out there. People struggling from chronic metabolic syndromes, or even, again, chronic pain. And so we had different courseworks, or courses that helped us along the way, sort of, again, understand the disease state from a global perspective. What the treatment guidelines, if they even existed, what they were at that time, and then trying to apply those to those disease states. But really, the specialty training typically comes for me after graduation from pharmacy school. So, like many of my colleagues, there's this big push for all of us to do residencies at the time, and residencies in hospitals, ambulatory care clinics, indigent care clinics, you name it. And I remember I applied to 4 of them. I applied to 4 VA hospitals. I said to myself, well, if I'm going to go and do a residency, then I'm gonna apply to the VA. Again, I love being in connection with people of the military. I love working with military families, even to this day. Um, and so I said, if I'm going to do this thing, I'm going to do it at the VA. Well, I came really close. It's a very, very, very competitive process to get a residency, and so I came very close, but ultimately I didn't get accepted. And so my career trajectory was really straight out of college and into the community setting. Even though I had a passion for patients with HIV/AIDS, unfortunately, none of those panned out for me. And so I went into the community setting, graduated from college, went into the community setting, and right out of college, they set you up. Right out of pharmacy school, they set you up, from my experience anyway, as a pharmacy manager. And it's a shame, because there really is no training on how to run a business. Again, that's changing now. Now, students that I've been working with, or have worked with in the past, they're dual majors. They're pharmacy students and majoring in business administration. So, again, the field is changing, and for the better. More of my colleagues are more in that have that more entrepreneurial spirit, and are working towards developing their careers and stuff. So, but yeah, that's sort of a nutshell of my early career. Where I went to school and sort of where I am today.
Wow, thank you so much for sharing. What a cool story. I actually did particularly well in organic chemistry 1, but then I got a little too confident, and so the C that I got in organic chemistry was actually organic chemistry 2, because I thought I said to myself, "Man, I got this," but apparently I didn't.
Uh huh.
But much respect to you on that, and you bring up this really interesting concept about not necessarily getting any sort of business training in school. And for those who are not familiar with the pharmaceutical, like the pharmacist profession, now it's a PharmD, it's a doctorate in pharmacy,
Yep.
pharmaceutical sciences, right? And so with that, just like in physical therapy, a clinical doctorate for physical therapy, we're taught all the necessary things to keep our patients safe and to take care of them, but we have very little to no business training. I remember when I was in school, we probably did one business class where it was like open up your own clinic. And to hear Matmon say that that's starting to evolve, and like having people get those double majors where you're combining both the healthcare and business, I think it's really huge, because as a result, what you listeners might have experienced in the past is when a business isn't run correctly, whether it be healthcare or whether it be anything else, like the service actually in itself isn't as good, because knowledge can only go so far, but we need to have that infrastructure for you to be able to get the care that you need. And so I'm really happy to hear that they're starting to combine that. And I start to see that in the physical therapy world as well, which is really cool. And so, yeah, you really just jumped right in 2 feet first,
Yeah.
managing a pharmacy clinic, so or a pharmacy. And with that, if we look at the medical management, which would medical management not including surgery, because surgery is the most invasive. It's not the conservative measures. Conservative measures to treat pain like sciatic pain and low back pain. Conservative measures is through pharmaceuticals and movement therapies like physical therapy and chiropractic care and acupuncture. And there are a lot of different classes of medications out there. And it's really tough. I see it on the Facebook groups. I see it everywhere else where people are asking me, or asking in general, asking the world, well, what's the best type of medication for sciatica pain? And Matmon, with your experience in the pharmaceutical world, in pharmacy, what are some of the commonly used medications that people would use when it comes to addressing pain, but then particularly possibly like the nerve pain, spinal pain, arthritis pain that could come coincide with sciatica issues?
Yeah, and I really have to say too that this epidemic, if you will, of chronic pain, whether it be sciatica, whether it be chronic pain following a surgery, or following some type of accident, it chronic pain, treating chronic pain is very challenging, for a number of reasons. And my experience straight out of college, again, I went into that pharmacy, that community pharmacy, gung ho and just zealous that I'm gonna help people regardless of their um their condition. And I really did have a rude awakening when it came to specifically to patients with chronic pain, because there's all this stigma, surrounded by patients who take chronic pain medications. For example, patients who take oxycodone, patients who might take Lyrica or pregabalin to help with nerve pain. There's all of this, again, this stigma, because these substances are controlled substances. They're highly regulated. And so for me, I remember stepping into that pharmacy as a brand new grad, a pharmacy manager. I've got a team now. I've got to manage a whole pharmacy that I'm responsible for. And it was right in the middle of the opioid epidemic. And so, I remember having to turn people away, bringing in prescriptions because maybe their doctor was, in concert or associated with some sort of pill mill, for example. And so, my experience, unfortunately, was a little bit jaded early on when it came to, again, treating patients with pain or with chronic pain. And so, seeing those prescriptions come across the proverbial desk, um, it more so came down to, well, how do I help this individual, but then also how do I help on a broader level the community if they are diverting, and then how do I protect my license? So this is a lot for a new grad to think about. Even today there really isn't a lot of guidance around treating patients with chronic pain. There are some organizations out there doing some work to try to help change that, but because chronic pain syndrome is it really is a subjective, um, you know, field, or subjective uh, field of medicine. They ask the question, well, how's your pain on a scale from 1 to 10? Well, I mean, to me it's a 10, but to somebody else it might be a 5, or to somebody else it might be a 20. And so that level of subjectivity involved in treating pain is again another one of those barriers that we as practitioners must be cognizant of when we approach a patient, or have a conversation with a patient who is struggling with chronic pain. And so I recently joined the great group of people, the Functional Wellness Network, to help educate patients and help them obtain access to really invasive and affordable testing methods, to show how well our body is able to recover from chronic pain or from chronic disease states based on their antioxidant levels, and how well are they currently functioning. How well is their system that controls their antioxidant levels? How well is it functioning? And so, using this non-invasive and affordable method, I might be able to share that with you here in a little bit. We've talked about it previously, but for me, this is an important first step, because it's a way for us to analyze. Because unlike conditions like diabetes or conditions like hypercholesterolemia, there is no assay, to my knowledge, that says, well, this is the level of pain you're in because blood levels are doing such and such. That type of test doesn't exist. So how do you measure someone? How do you get some insight into what's happening on a on a microscopic level in their body that's causing this pain, again, following a surgery or following some sort of accident, or whatever might have happened in their life, and again, get to that level to begin treating them. So I can continue. I don't know if that answers your question.
That answers it perfectly. What you brought up a very interesting point, like really early on in what you were just saying, where
Mhm.
I started off with a question. I was like, well, what are some common medications that people use, like when it comes to treating something like sciatica pain? And you brought what you said was very intriguing, because this is actually how I treat my clients as well. But you actually ended up asking, like, before saying like, oh, this is like X, Y, and Z medications, like treat X, Y, and Z, you actually listed, I think, like 5 or 6 different questions about, like, even before saying like, this is what we could do. And I think especially when it comes to something so subjective, as you said, such as pain,
Mhm.
asking the right questions and having to ask
Mhm.
more questions and getting more information to get a better understanding of what is the best route for that person is really key when it
Yeah.
comes to managing. Because in for you listeners out there, the education that pharmacists go through, physical therapists, chiropractors, doctors, um, we're all trained in the sciences, but really what the education and what our profession does and drives to is being clinical decision makers. And
Yeah.
being clinical decision makers, we have to get the necessary information to
Yeah.
make the best decision possible for our patients. And you can't get the necessary data unless you ask the right questions.
Yeah.
And this brings me to a very big actionable step for you listeners out there. If you're going to a physical therapist, a chiropractor, or even a doctor, and if you notice that they're asking you very little to no questions based off of what you're feeling, then they probably already have some sort of preformed diagnosis in their head, and
Mm.
it is going to limit their ability to treat you. And to Mattman's point, it is hard, because with something so subjective, you can't say this is scientifically happening on a cellular level, which is causing the pain.
Yeah.
And to inform you listeners out there, there's three types of mechanisms for pain. And what I've learned in my when I would take my pharmacology classes in school was that each one of these medications that are prescribed, I kind of actually like fit along these three different types of pain mechanisms. But
Mhm.
I do have to clarify that pain is a subjective experience, but really pain is an electrical signal that goes from whatever body part and gets processed in your brain. And your
Yeah.
brain actually has to perceive that information. And that can be perceived as a normal sense of touch, or it can be perceived as something that is actually causing harm. And there's three major mechanisms for you listeners out there. We have our nociceptive pain, which is called what we call like our tissue pain, where our tissues, once you injure it, there's inflammation and it actually irritates the nerves, and that's where you experience the pain. Um, would you say, like, when there's inflammation, Mattman, that when people are going through extreme levels of inflammation, that some common things that people would take would be like some sort of anti-inflammatory?
Exactly. Yeah. And we know that those drugs, anti-inflammatory medications, ibuprofen, yeah, celecoxib or Celebrex, those those medications have so many side effects. There's this wave of I think that pharmacists, a lot of us really are waking up to the idea of and the importance of understanding what's happening on a micronutrient level, for example. So when you look at a patient's um, inflammatory response to their condition, how well their body is able to manage that inflammation, um, either with or without some form of medication being on board. And let me back up too, because I really think it's important to understand, for me anyway, and maybe for your listeners, that I view pain or experience with pain as a hill. At the bottom of the hill, you have your experience, right? Your initial experience. Again, it could be a trip and a slip and a fall. It could be a surgery. It could be, really whatever circumstance causes you now to have an experience with pain. Okay, so that's at the bottom of the hill. And then I think the patients sort of begin to climb that hill towards recovery. At about the quarter of the way up the hill, they are they're still struggling with this, um, coping, struggling with how to figure out how to cope with this chronic pain, that now they've maybe experienced for 2 months, maybe they've experienced for 6 months, maybe they've been struggling with it for a whole year, multiple years, and so they're at the quarter of the way of up the hill, and they're still learning to cope, learning to deal with the stigma around this chronic condition that just won't go away. It's not like again diabetes or some of your metabolic syndromes where some good diet and exercise can help go a long way in improving outcomes. But when you talk about chronic pain, man, I mean it's and you talk about going through rehab. It's important for people to connect with folks like you, Ashley, frankly, who are looking outside of the pharmaceuticals, because I'm going to be honest with you, pharmaceuticals, and I think this is where I was going when I talk about this step on the hill, or this level of the hill that patients with chronic pain struggle with. Pharmaceuticals really act as a band-aid. And I think it's important for providers, it's important for patients to know that these pharmaceutical drugs don't cure your pain. They really mask a symptom. And so it's important for us as providers to come back and say, well, what are some non-pharmacological ways that we can help our patients overcome their pain? And again, it's going to be subjective to them, because everybody's going to be at a different point on that hill. So at about half the way up on that hill, maybe the pain has been alleviated to a degree now that the patient can begin to work out, maybe do some small rehab steps. Again, working with you, you're the expert here on that. Working with you, working with a chiropractor, working with somebody who can again look non-pharmacologically, to work, to continue to help them climb that hill to recovery. And then now they're at the top of the hill. They've got all of their providers in. It's a multiple discipline. Really should be a multiple discipline um, process. You've got pharmacology on board. That's great. You've got somebody like you, a trained specialist in physical therapy, doctorate. You have a chiropractor on board. Whatever is going to be in your niche as a patient that you feel you need, and maybe your other providers feel you need. You include all of those perspectives in the treatment of chronic pain, and then you help that patient toward healing. And one thing that I'd wanted to mention, when it comes to this, measuring your micronutrients, for example, there are, good friend of mine, Dr. Brittany McCoy, I believe you met her. Again, she's a part of the Functional Wellness Network as well. She made me aware of this website that can actually tell you if your current medications are causing you, for example, to have some type of chronic pain. Maybe you have diabetes, and so you're on metformin. Well, metformin reduces your vitamin B12, and vitamin B12 is important for nerve function. So, you take these medications to hopefully help alleviate, metformin to help alleviate blood sugar. If your blood sugar is elevated, then you're going to have nerve pain. And so you take the metformin to reduce your sugar. Hopefully, that the nerve pain will go away. But in actuality, the metformin is reducing your B12 and also causing further damage to your nerves. And so understanding the importance of micronutrients, man, again, it's growing, and more of my colleagues are are aware of this, and are jumping on board to help our patients look outside of those drugs that have been or drugs, pharmaceuticals that have been traditionally used to treat chronic pain. But micronutrient deficiency is a conversation that we all need to be having with our patients. I can just to mention another one, magnesium, for example. Magnesium is again another one of those nutrients that's important for nerve health. So for somebody with sciatica, well, are you going to measure their magnesium levels on a regular basis? Is there even a standard for that? What's the scientific evidence behind that? What are we doing to look at some of these things to say, well, it's more than just the pharmaceuticals. We really have to get down to the nuts and bolts, if you will, of treating our patients, outside of just pharmaceuticals. So
I love that. It makes me, and was great because prior to this call, I sent you a whole bunch of questions that I thought would be great. But now, after hearing more of this, I'm like, okay, well, maybe we'll change the direction of today's conversation because I think a large part of it is the fact that, yeah, there is a place in the world for, say, from like a pharmacological medication standpoint. But you make a really good point about the concept about how these pain medications, like specifically from a pain management standpoint, is going to be putting like somewhat of a band-aid, and that there are many things that we have to look at in a multi-level. As you said, you were talking about how metformin can actually reduce vitamin B12 levels, and that's going to further affect nerve function. And so this brings to mind, it was like the big question, you said this a couple of times already, was the concept of the use of like antioxidants and micronutrients and how that actually facilitates it. And from a physical therapy standpoint, I look at, okay, well, we have these three major pain mechanisms. We have general inflammation, the nociceptive system. We have peripheral nerve injury, where you're actually injuring the nerves themselves. And then the third one, which often gets overlooked, is what we call the central nerve lesion. And that's also like and that's what happens in the brain, the central nervous system. And we're looking at all three of these components, and they don't act independently of each other. They're all a combination. And so my interpretation when it comes to the implementation of medications is trying to hit trying to hit one of those specific pathways. But in the reality, as you said, when it comes to micronutrients, comprehensive treatment, and having a team management platform, you can't just address one specific thing at a time. They're not working independent of each other. And so it's really exciting to hear. So like when it comes to antioxidants, because I think antioxidants was like a super buzzword back in like the early 90s, and it's starting to come back again. Like I use antioxidants as my excuse to drink excessive amounts of coffee, right? Because they say coffee has a bunch of antioxidants. I said, well, I'm going to drink as much as I can before 2 p.m. But tell us a little bit more about like the role of antioxidants, like from your standpoint, and why you think it's so amazing. And I'm really more so saying, like, I know it's amazing. I want you to tell the rest of the world and why it's so amazing versus like,
sure, yeah.
So yeah.
Certainly, yeah. And and again, I think again, a lot of my colleagues have put forth this work, again, not just colleagues in the pharmacy world, but also in the physicians, in the medical doctors, people who see patients on a daily basis and help them through this. Like you mentioned, antioxidants was a buzzword, and to some degree it still is, because there's really this education that needs to happen around what the heck is an antioxidant to begin with. And so the specific types of antioxidants that I'm referring to are those things known as carotenoids, and carotenoids are found in those foods that are bright in color. We always say, you want to eat the rainbow when we talk about putting on board or putting on your plate. And there's some really beautiful plates out there on Instagram of people who are eating the rainbow, not Skittles, not like tasting the rainbow, but eating the rainbow in terms of their dark colored greens, their orange foods, their purple cabbages, those types of things. And really what they're doing is fueling their body with antioxidants. And so let's take a step back. So what are antioxidants? From a general perspective, for your listeners, antioxidants are those things that help protect your cells from decay. Now we all age. We're all gonna, I don't think anybody's figured out that magic pill yet that'll make you live forever. So we're all gonna, approach the end of life gracefully, hopefully. But the antioxidants, what they do is they encircle your cells, and they help protect your cells from free radicals. And the only way to get antioxidants, or a major way to get antioxidants, is by oral consumption, again, in your foods. And then another way is by way of supplementation. And Ashley, you know this. When a lot of times when we eat our foods today, unfortunately, they don't have the power that they need in terms of their antioxidant potential, just because of environmental factors, mass production of foods. So by the time it gets to us, it's picked too early. You think you're gonna get some benefit from that carrot that you're going to eat. Well, maybe that carrot was picked too soon, and so it doesn't really have or pack the needed nutrients. It's still good that you eat it, right? You still want to go ahead and consume it as long as you don't have any allergies and whatnot. But the point is, you still need to be looking at supplementation. And so, I had mentioned earlier that I joined forces with a good group of people. Again, doctors, pharmacists, chiropractors, people who own med spas, who see the value and the benefit of supplementation in the life of their patients and the people that they help and that they see on a daily basis, and how these antioxidants help, for example, help your body better fight that inflammation that you might be having, that chronic inflammation that you might be having. Antioxidants help you recover from sickness faster, because again, your cells are protected from those free radicals. It acts as a barrier, a wall around your cells, on a microscopic level, and it gives you that ability to fight off foreign invaders. Gives you that ability to reduce your inflammation. So all of these things that we're talking about today, we're talking about, and our focus is on pain. And I know your folks are tuning in on this podcast because, maybe they're looking for some answers on how to better handle, how to better deal with their pain. I can't stress enough how well and how important supplementation is to that process. Again, I mentioned earlier about that hill, viewing chronic pain as a hill. Somewhere along that hill, on the descent down, supplementation needs to be a conversation that we have as an ongoing, because we're talking about all natural products and all natural methods to help patients back or get back to health. Because what we don't want, is if we lean in on those controlled substances, the other thing that we have to think about is the risk of, addiction. And boy, we can have a whole conversation about that. But all of these things need to be taken into account when we're talking about treating patients with chronic pain, treating patients with chronic metabolic syndromes. Supplementation is a big part of our health and how we walk back towards being our healthy selves.
And if we're looking at the concept of chronic pain, folks, if you're like listeners out there, like when you're experiencing pain for a long period of time, like the medical term for chronic is going to be 3 months or more. And the
Hmm.
thing is that when you're experiencing pain for that long, is that it influences every other aspect of your life. Like if you're in
Yeah.
pain, you won't be able to exercise as much or as effectively as you would like to, and it's going to end up resulting in a reduction in your energy. Your body's going to be stiffer, and then you combine that with the pain that you're going through. All of a sudden, your energy levels go down. You end up eating less vegetables because it's a lot easier to order takeout and eat all of those easily accessible foods. But one of the things is the fact that if you're not having control and you're not getting these nutrients, particularly the antioxidants, then it's going to be just another big step that you have to overcome through that. And I think as you were telling me about this, I was thinking, well, it doesn't really sound like antioxidants really have too many side effects either, because like especially if you're looking at pain medication, there's a lot of side effects. Like if you're
Oh
looking at
man.
taking something like a muscle relaxant, right? You're going to be sluggish, you're going to be exhausted, and I mean, the only side effect of eating antioxidants or taking oxygen supplementation, the only side effect is that you're going to feel amazing,
Right.
right? And
Yeah.
I'm just doing so.
Yeah.
Yeah.
Yeah. Well, we want to be sensitive, right? Because again, some people have allergies, right? So
Yeah.
we do want to be sensitive to that. Somebody might have an allergy to spinach, or if they're taking drugs like warfarin, then they have to be careful consuming their dark greens, because then that can change their what's called an INR, which measures how thin your blood is, or how easily you'll bleed. If you were to get a cut or something like that. And patients who are taking warfarin, they know this. They know this very well, and they're probably nodding their head as they're listening. But so we do want to be sensitive to that when it comes to consumption of these things. And it's about balance. We here in America, our balance, we're unbalanced when it comes to our diets, man. I mean, we lean more on the fried foods, we lean more on the processed foods. My pantry, for example, very, very few. I mean, I have two boys, and so sometimes we do buy things that are quick, and I get it, right? That's just the nature of life here in America. It's go, 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 go. Sometimes you do have to, and parents can attest to this, have to give in some time and buy some things like Teddy Grahams, for example. But the point is to limit those processed foods as much as possible, because you're literally getting no nutritional value from them. They're chock full of carbs, chock full of sugars, and very little B12, for example, or folic acid, or vitamin C, all of these things that we need. So, you know, um, it's important, yes, and I won't make the claim that there aren't necessarily any side effects, because again, it's going to be individual. But the goal is to get the patient to move back towards the center, when it comes to consumption of these antioxidants, when it comes to consumption of these supplements. Get your vitamin C, again, your B12, your vitamin Ks, your folic acids, your luteins, your lycopenes. Get all of these things that your body needs and your brain needs, in order to feel healthy overall. And then you can hopefully start to move away from those chronic pain medications, like the oxycodones, the anti-inflammatory drugs that upset the GI tract, and just get back to normal health. And like you said, when you start to feel better, there's this natural tendency to go, well, I don't need this today. I don't need this. Hopefully, I don't need this pain medication today. Now, if you're taking something that has a high abuse or a high addictive potential, again, like the oxycodone or the narcotics or whatnot, then that's a different conversation that you need to have with your physician and your pharmacist and whoever else is on your team to help get you, weaned off of those things. Or if you're a patient who's taking chronic steroids, for example, prednisone. Some people again take those things to help with chronic pain or inflammation and whatnot. If that's you, just know that there is a way for you to improve your health, again, by way of supplementation, and getting these foods ingested, so that you feel better overall.
Right on, man. Right on. So, I mean, I think a large part of it, now listeners, interviewing Matmon today and taking a deep dive into some of the medications and learning all about the magic of the use of antioxidant carotenoids, and then also even the supplementation standpoint. This isn't to negate any of the things that your medical professional has to say to
Right.
you. In fact, really our goal is to help inform you so you can ask the right questions and so you can be an advocate for yourself so you can get the best care possible. And to Mattman's point, it's all about balance, because if we're looking at our health is on a spectrum. Let's say one side of the spectrum is sickness, and you want to get out of that sickness part so you can sit right in the middle, maybe beyond the middle, where we're going on the wellness standpoint. But then we also have to be careful and not going on the complete opposite end of the spectrum of doing way too many things that we consider healthy to put ourselves in some sort of unhealthy position that can actually put ourselves at risk. And so being able to look inside and see what is going to serve you the best, that is going to be really, really huge. And understanding that it is a team effort. And, going into this conversation, I was thinking about how can we actually start tying in the concept of pharmaceuticals in the pain management standpoint. Now, myself as a physical therapist, my job is to not tell you what medications to take. That is outside the scope of my practice. That's where we're looking at the role of an MD, a medical doctor, a DO, any of those folks who are licensed and trained to prescribe medications. And it is important for you to be able to communicate with your medical professional throughout this entire process, because it is a team effort. As Matmon said, it's a collaboration of professionals where everyone here is working to help you specifically. And a large part of it is to make sure that you are having the right supplements, the right chemicals, whatever, and also even the right treatment to make sure that you are nice and healthy. So, Matmon, this has been an amazing conversation that we've had today. As I said before, I was going into this with the ultimate goal of actually helping the listeners who are experiencing sciatica pain learn a little bit more about the different medications that can be used to help treat their pain. But going in through this, we realized and learned that there are many different ways for us to address this pain. And my expertise is from a movement and say like a movement and lifestyle standpoint. But with your experience of being in the pharmacy industry and seeing the complexities of pain management and how it is so hard and challenging to be able to quantify the effectiveness of pain, but then also leading to the point where you came across the magic, not magic, it seems kind of like magic, but the power
Yeah.
of antioxidants and even the use of supplements as well. So thank you so much for being able to take the time out of your day to share this with our listeners. I want to give you an opportunity to tell the audience like what you've been working on your end and how you can help people.
Certainly, yeah. So thank you, Ashley, again, and it's always a pleasure speaking with you. And right now I'm really focused in on a number of things. Primarily, I have a podcast out, the Mindful Farm D podcast. If your listeners are interested in that, we talk there about mental health topics, mindfulness, obviously for the namesake podcast, and and hopefully it's a way for us to have these conversations about mindfulness, but also a way for me as a pharmacist to help patients understand that there's more to us than just as they say, lick, stick, and pour. Okay, we are knowledgeable. There are a lot of my colleagues out there who see patients on a regular basis. And so, for example, I've had one colleague on who's into pharmacogenomics, and so and that's a whole conversation that we could have. But if you're interested in that kind of thing and want to know what that is, go check out the season one of my episode, my podcast, the Mindful Farm D podcast. And actually, I'm in the process of releasing episodes for season two. And so if you want to get caught up on that, certainly check that out. Outside of that, folks can check me out on Instagram at the Mindful Farm D, and that's mindful with one L. I had somebody say to me, "Oh, you spell it with one L." Yeah, I mean that's how you spell mindful. But yeah, so the Mindful Farm D, and then also you can check out my website, Dr. Matmon Harrell .bio.link. Dr. Matmon Harrell, all one word, .bio.link, and that will have all of the projects that I'm working on. Anything you want to click into and connect with me, they can do it via those means. So.
Fantastic, folks. I'm actually going to put all of Matmon Harrell's information, his website, his podcast, all in the description of today's episode. So if you want to get in touch with him, check that out. I want to share with you one quick story about my amazing experience with the pharmacist. Earlier this year, I actually had two really bad allergic reactions. I had one allergic reaction to a series of bug bites when I was in Florida. It was so bad that I actually had to take a week's worth of prednisone to bring down all the swelling and calm that down. That was probably the first time that I've taken prednisone and probably forever. And so I did that, spoke with the pharmacist, wanted to make sure that I was doing everything correctly and I wasn't putting myself in harm's way. And then my favorite interaction with the pharmacist this year was when I actually had an allergic reaction to mango. And
Oh, wow.
I had an allergic reaction to mango. So I spoke with the physician via telehealth and I went to the pharmacy and I was just in casual conversation saying like, oh, I had like an allergic reaction. I'm not really sure what I had. And being that I'm not from Florida and this was like a Floridian pharmacist, she was like, oh, you probably had mango and that's probably why. And she walked me through the entire allergy reaction process and then really just helped me get really a ton of peace of mind on how to manage that. So that was really cool. And yeah, you pharmacists do some really great work, and I'm so glad that we had the opportunity to meet, Matman. And again,
Certainly.
thank you so much for your time.
Amen. Yeah, man. No doubt, Ashley. And I look forward to staying connected with you, man, and seeing your practice grow. So, yeah, look forward to speaking with you again in the future.
Fantastic. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.